Alright, so to perform a nasogastric feeding, before I go into the room, I would check the patient's chart to ensure that they don't have a food allergy, and I would also check the healthcare provider's order to see the type, the amount of the feed, the route of the feed, as well as the frequency it should be given. I would go into the room, perform hand hygiene, and don my gloves. I would identify the patient and I would close the door or the curtain. I would then put the patient into a Fowler's position, either right side lying or regular Fowler's. And I would then start checking to see gastric residual volume. So I would take the tube and I would clamp the tube off before I insert my syringe. Then I would unclamp the tube and I would aspirate the contents, and if it got to 60 milliliters, I would clamp the tube before removing the syringe, and I would put it into a vessel, and I would reattach the syringe and unclamp the tube and pull out however much was left. And so in this case, the first was 60 and this is 20 milliliters, so it would be a total gastric residual of 80. So I'd push whatever little bit I had in here left, clamp the tube again, pull out whatever I had in the vessel. In this case it was the full syringe, and I would reattach the syringe, unclamp the tube, and re-push the 60 back in. If the gastric residual volume was over 500 milliliters, that's when we would discontinue our feed and contact the healthcare provider. In this case, we're going to clamp the tube and remove. We're going to prepare the feed. And so then we would remove the plunger from the syringe, reclamp the tube, put the syringe in, and we would fill the syringe halfway with the feed and unclamp the tube again. And then we can higher or lower the syringe in order to slow or quicken the rate of the feed. We'd want it to go over around 10 to 15 minutes. And before the syringe empties fully, we would add a little bit more feed up until the point we reach the desired amount of feed. And before that last little bit emptied, we would reclamp the tube, and we would add 30 to 60 milliliters of room temperature water to the syringe and unclamp. And then we would reclamp it before the amount of water ran out to prevent airspace. So we would remove the syringe at the end, reclamp there, and we would want the patient to stay in that Fowler's position, either regular Fowler's or side lying, for 30 minutes or preferably up to an hour. And we would clean any reusable equipment with water and dispose of any equipment, and we would change it every 24 hours. And we would perform hand hygiene and document the procedure, including the gastric residual volume, the type and amount of feed, the amount of water used, and the patient's position and how well they tolerated it. So to remove the NG tube, we would go in, perform hand hygiene, and identify the patient. We would close the curtain and the door, and I would put the patient in a high Fowler's and don my gloves, and I would have the patient untake the nose. I would untake the nose, have the patient take a deep breath in and hold it, and I would remove the tube. I would dispose of the equipment, I would perform hand hygiene, and I would document the procedure and how well the patient tolerated it. And that's it.